All right, everybody, I think we'll get started. Thank you all for coming and for being here. I appreciate it. So, I'm Dr. Ayaz Virji. I'm Chief of Staff at Johnson Memorial Health Services. And this is a series of talks that we're giving to the community called Conversations That Care. And these are short discussions. We don't keep you here forever, with an open Q&A session, and hopefully giving you information, medical-wise, that's practical, and that you can also take home the next day and implement if you want to. I think Dr. Hansen at the last talk talked specifically about the use of sunscreen, which SPF, what are the latest guidelines, what are the risk benefits, and the like. So thank you all for being here. So I'm going to do a 15-minute talk about lithium. Lithium and memory. So dementia, memory impairment. Wait, I forgot. No, I'm just kidding. No, so talking about lithium as a nutritional supplement and what are the potential benefits of that for people who are looking for such benefits. So lithium is interesting. Does anybody know what lithium is? It's just a mineral. It's in the dirt, okay? Whenever I heard lithium, I would think of those batteries, right? The Tesla batteries, those lithium-ion batteries. And they're there also because it's a metal. It's a conductive, element. But it's just something that we need, and our brains need, and that our body needs also. And who's ever drank 7-Up? All right, so 7-Up is named after lithium. Did you know that? So the atomic mass of lithium is 6.984. And they originally put lithium in 7-Up to give you a kind of a pickup because it's known to have a good mood stabilizing effect, make you feel better. But no one's going to take 6.984 up. But 7-Up they drink, right? I might drink 6.984. I might try it, But so they just round it up, and that's where they got the name. So back in, I think it was 1918, when 7-Up first came out, or no, it was 1929. And then they kept it in there for a while until 1948, where regulations told them, hey, we don't want people feeling good. We want them feeling bad so we can sell them drugs. So then they took it out. So I want to talk briefly about some of the studies. I just want to make it very clear and kind of ground level, and then talk about kind of how I do it and how I look at this for people. So there was a study done in Denmark which showed that lithium concentrations in the soils of various counties, they went from county to county. The higher the lithium concentration, the lower the risk of dementia. It went down by 18%. And the lower risk of suicide. Interesting, right? You would have thought, what is a suicide thing? So have you guys heard of antidepressants? Like Prozac and Zoloft and Seroquel, all this stuff. Do you know the two antidepressants that are associated with the lowest risk reduction of suicide? Do you know what they are? So I just told you one, lithium. Now you wouldn't have expected that. And the second is ketamine, what we do infusion-wise to help them more acutely. But lithium has been shown to reduce risk of suicide, independently of these other things that we're looking at, because it does work on the mood. Lithium works on the mood in the brain. And what we've seen is that it naturally inhibits an enzyme called GSK3. GSK3 is kind of an inflammatory, oxidating enzyme in the brain that tends to be high in people who have chronic pain, chronic depression, chronic mood issues or anxiety, causes inflammation. So lithium brings all of that down. In some traffic here. It also increases another hormone called neurotrophic brain factor, which is very important for brain healing and repairing of neurons. So lithium brings that up and brings the other bad one down. And what we've seen from a clinical standpoint is, from a mood standpoint, lithium supplementation, and I'm talking about microdosing here. I'm not talking about the prescription lithium that we give for bipolar disorder. That's a whole different category. That's high dose of lithium carbonate. That's a whole different compound altogether. I'm talking about the stuff you can get at the grocery store, at the shelf. You can buy your own on Amazon. Lithium orotate. You don't need a prescription. This is low dose. And one of the things we've seen, the most common dietary source of lithium? it's water. It spills in our water, but we don't drink tap water anymore. We drink bottled water and reverse osmosis, and none of us are actually getting it anymore. And it's funny because we see lithium concentrations going down, and then we see dementia concentrations going up. Now, that is an interesting association. That is happening, by the way. Now, when we look at that, that's just an association or an observation. That's not a clinical trial yet. So that's just something that we can say, this is interesting. But what we found, and I've taken a deep dive in this, understanding the biological plausible mechanisms as well as the clinical science on the use of lithium, low dose. We're talking like 5 or 10 milligrams of lithium orotate. This is what you get over the counter. And contextualizing that with the best evidence that we have available, as well as any risk of harm and cost. And from that assessment, I think it's actually a reasonably good idea for people to do it, to take it, especially if you have concerns for memory, concerns for dementia, or if you have a family history. Even though we don't have enough data for it to be totally prime time yet, number one, is it going to help you? Maybe. Number two, is it going to harm you? No, not at these levels. When you go to the high levels, you can have some side effects, but these levels are, you don't need to follow any lab parameters or anything like that. And what's the cost? It's cheap, maybe $5 a month. So what would be the harm in doing it? Now, I was looking at a lot of this stuff before, but then the latest study came out from Harvard about 9 months ago, and it was a very elegant study. I don't usually see it this nice, but they did it was actually a series of studies, and what they did is they looked at people with Alzheimer's disease, and they actually looked at concentrations of lithium in the prefrontal cortex of those patients, and also concentration of lithium inside of the plaques and the neurofibrillary tangles that we get inside the cells. The tangles are inside the cells, the plaques are outside the cells in Alzheimer's disease. And what they found is that people who had Alzheimer's disease or mild cognitive impairments going toward dementia had a reduction of lithium in their prefrontal cortex. Prefrontal cortex is the part involved in thinking and problem solving, decision making. It communicates with various parts of the brain back toward the limbic system, which is then responsible for memory and emotion and things of that sort. So a lot of connections going on between the prefrontal cortex and the limbic system, which help us exist and do our tasks and to think and problem solve and the things of that sort. So they found that that was the case. And what they also found is they took a bunch of mice. So they did a human portion, which these were humans who had died post-mortem. You can't obviously do these on living people because you have to do brain biopsies. But they did a group of mice, and they had some transgenic mice where basically they changed the genes to give them Alzheimer's disease, give them the plaques and the neurofibrillary tangles, and then a group that didn't have it. And they put them on a lithium-poor diet, no lithium. And then they ran them through these mazes. They couldn't get through. They had no idea. They lost their memory. They performed very poorly cognitively in this setting. Then they went and then they fed them lithium, a lithium-rich diet, lithium supplementation. And they actually got some of that back. They were able to move through the maze, and the kind of cognitive scores that they have for mice, I didn't know that existed before the study, but hey, it does. They actually improved in this, which was quite remarkable. Now, to me, that's one study, and science is like statistics. You can always find a statistic that will justify something. I mean, politicians do it all the time. They look at the same number, and one person says, this is the terrible, another person says, this is the best thing in the world. So science is similar, but when you see scientific studies done at a high caliber like this, as well as done in multiple different locations in the United States as well as internationally, plus different researchers who do not have any commercial interest, or they're not sponsoring the drug or anything like that, and they're all coming up with benefit, then this, at least to my mind, comes together as a nutritional supplement that has an effect and potentially has benefit for those who are worried. And then we combine that with the ecological studies where we're just not getting lithium anymore because we're all drinking, myself included, reverse osmosis water, which takes out 99% of lithium. And it's not as high in our soils. And I often wonder, because I see, we all know kind of the mental illness epidemic is kind of getting worse in our country and worldwide. I think it's multifactorial. I think there's lots of things that are driving that. Maybe social media, lack of connection, terrible politics, perhaps a lot of different things going on, I think, driving that. But I often muse about, what other things are maybe contributing to that. And when I see dietary deficiency, or if I see other things that perhaps can have a positive effect, that, number one, are they going to help? Maybe. Are they going to hurt you? No. And how much does it cost? Very little. Then it feels like those are things that we can actually do now, like tomorrow, that could potentially be of benefit. Okay, and I would just say this with a caveat, because most times when I talk about nutritional supplementations like N-acetylcysteine or L-carnitine or vitamin E, many times people will come up with like a pendulum effect. Either one person will go and say, wow, this is the best thing since sliced bread. I'm going to stop all my medicines. I'm just going to take this. No, don't do that. That's not what nutritional support does. Nutritional support supports. It doesn't replace treatment. Others will go to the other side and say, well, this is all voodoo science. It's not doing anything. I'm just not going to do anything nutrition-wise. That's not true either, and there is a healthy middle where you can intelligently navigate through some of the, nutraceuticals and the products out there to help individualize various supplementations for you and for what your goals are and what you want. And it is complicated, though. It's hard because companies always, they'll do like one study that they, will be the ones funding, and it'll look good, and they'll say, look, scientifically driven, this is the best thing, and that happens too, unfortunately. So that's a marketing ploy many people fall into. So back to lithium, it has enough data. It has enough data in different contexts and by people who are not commercially invested in it. It shows to me clinical scientific data as well as biological plausibility when we see that these plaques inside of the Alzheimer's cells are just trying to extract lithium, that there's probably enough for somebody who wanted to make a decision on their own to do something nutritionally to support them, to start taking a lithium orotate supplement. It has enough data. It has enough data in different contexts and by people who are not commercially invested in it. It shows to me clinical scientific data as well as biological plausibility when we see that these plaques inside of the Alzheimer's cells are just trying to extract lithium, that there's probably enough for somebody who wanted to make a decision on their own to do something nutritionally to support them, to start taking a lithium orotate supplement. So that's all that I have to say about that. I don't want to go too long. I know this can get very long, and I tend to nerd out on these things and bore people to death. So what I want to do is just open to questions. Yes?
Okay, we have a well, our own well.
Yeah.
Okay, but it goes through a water softener. Does that take out the lithium?
No, water softeners don't. Reverse osmosis would. Water softeners just take out calcium and a couple other things that make the water hard, but you'd be okay. Maybe you're probably smarter than all of us then.
What about Prevagen?
Yeah, it's a great question. So Prevagen is another supplement that does not have this level of data. Prevagen is one of those that so Prevagen is a nutritional supplement over the counter. It comes from jellyfish. And there was one study which showed a positive benefit on memory, but that was commercially biased. There was a number of problems with the study. But hey, they got one study, they took it, they ran with it, and they made millions off of it. But no, it's not on the same level. Lithium's kind of up here. Prevagen is kind of down really low.
Thank you.
Yeah. Did you have a question, Mr. Bully?
I don't have a question. I just want to say thank you. This is the first experience that I've had. We lived here 63 years of our 67 years together.
Wow.
And it hasn't happened anyplace else.
Oh, wow.
And I just want to say thank you. It's the first time I've had a doctor explain something, good information to all of us.
Let's make sure you're taking notes, right?
In such, in such a good way, and we didn't have to pay for it either.
Oh, and you got free drinks. You got free drinks too, courtesy of JMHS. Yeah, thank you. I'm glad you came.
Thank you.
I'm glad you came. Thank you.